Hello viewers, this is Dr. Rajiv. Welcome to your education channel YouTube Surgery and Orthopedic Education. Please consider subscribing to it and sharing it with your near and dears to help them prepare not only for the MBBS course but also for other postgraduate and medical job entrance examinations. Please don't forget to hit the bell icon below so that you never miss useful lectures from us. This video will teach you 10 NEET PG entrance level multiple choice questions on gallbladder and bile ducts with explanations and descriptions. These may be useful for the foreign medical graduate examination as well as for combined medical services examination. The questions will appear first with a 5-second timer and explanation and description will follow. Now let us not waste any time and start right now. This video will teach you 10 NEET PG entrance level multiple choice questions on gallbladder and bile ducts with explanations and descriptions. These may be useful for the foreign medical graduate examination as well as for combined medical services examination. The questions will appear first with a 5-second timer and explanation and description will follow. Now let us not waste any time and start right now. The correct answer in question number 1 is option A. The hallmark feature of emphysematous cholecystitis is the presence of gas within the gallbladder lumen and wall. The diagnosis of emphysematous cholecystitis is usually made on plain abdominal film by finding gas within the gallbladder lumen as well as within the gallbladder wall or in the pericholecystic tissues. It is associated with both calculous as well as acalculous cholecystitis. Hence, the statement that the emphysematous cholecystitis is usually associated with acalculous cholecystitis is not correct. Bacteria most frequently involved in this setting are anaerobes such as Clostridium welchi or Clostridium perfringens and aerobes such as E. coli. This condition occurs most frequently in elderly men and in patients with diabetes mellitus. Gas in the biliary tree may also be seen normally after endoscopic sphincterotomy or following a gut anastomosis. The correct answer in question number 2 is option D. At present, most authorities consider that it is safer to observe patients with asymptomatic gallstones, and cholecystectomy should be reserved for patients who develop symptoms or complications. However, prophylactic cholecystectomy may be considered for diabetic patients, patients with congenital hemolinitic anemias, and patients who are undergoing bariatric surgery for morbid obesity. For patients with symptomatic gallstones, the laparoscopic cholecystectomy is the treatment of choice if there are no medical contraindications. Prophylactic cholecystectomy is also recommended in asymptomatic gallstone patients who undergo organ transplantation. The studies have shown that organ transplant recipients with gallstones have a higher incidence of developing symptoms and complications than the general population. Pregnant women with symptomatic gallstones who cannot be managed conservatively with diet modifications can safely undergo laparoscopic cholecystectomy during the second trimester. The correct answer in question number 3 is option B. Sense triad is the concurrent occurrence of gallstones, diverticulosis of colon and hiatus hernia. This may be remembered by the mnemonic SDH or subdural hematoma. S for stones, D for diverticulosis of colon and H for hiatus hernia, not inguinal hernia. There is no underlying pathophysiology that might explain The synchronous presence of these three conditions. Sent's triad was named after the British South African surgeon Charles F.M. Sent. The correct answer in question number 4 is option C. The regular triad or sign includes a small gut obstruction, a gallstone outside the gallbladder or ectopic gallstone, and a pneumobilia or gas in the bile ducts. It is a characteristic radiological sign of gallstone ileus. The presence of two of these radiological signs is considered a pathognomonic feature of gallstone ileus. The gallstone ileus occurs in elderly subjects secondary to erosion of a large gallstone directly through the gallbladder wall into the duodenum. Classically, the most common site of obstruction is about 60 cm proximal to the ileocecal valve. The correct answer in question number 6 is option C. The given image shows a dissected specimen of gallbladder. The gallbladder has been cut open and there are yellow tiny specks in the wall of the gallbladder. This is a typical picture of cholesterosis of gallbladder, which is also known as a strawberry gallbladder. This condition occurs due to excess cholesterol in bile, which leads to accumulation of cholesterol-laden macrophages within the lamina propria of the gallbladder mucosa. Gallbladder polyps are growths that protrude from the lining of the gallbladder. They are often discovered incidentally during imaging studies conducted for other regions. Most gallbladder polyps are asymptomatic and are often incidental findings. Adenomyomatosis, also known as cholecystitis glandularis proliferans, is a chronic inflammatory condition of the gallbladder wall. In this, there is a thickening of the gallbladder wall due to the proliferation of epithelial and smooth muscle cells, leading to the formation of intramural diverticula. These are usually identified by ultrasound or cholecystography. Generally, no treatment is required. Extensive calcification of the gallbladder wall due to chronic inflammation is termed porcelain gallbladder. In this condition, there is extensive calcification of the gallbladder wall. It is occasionally seen on plain X-ray and CT scan. The porcelain gallbladder is considered a pre-malignant condition. The correct answer in question number 7 is option B. Since no stones were detected on ultrasound and CT scan, there must be a soft tissue lesion blocking the flow of the bile into the duodenum. Hence, a non-invasive procedure that shows the entire hepatobiliary and pancreatic system will be the most appropriate one to further investigate this case. The only such procedure listed here is MRCP or magnetic resonance cholangiopancreatography. Therefore, this will be the most appropriate answer to this question. The correct answer in question number 8 is option B. Cholelithiasis is the most common disease of gallbladder and biliary tree. Gallstones are divided into three main types: cholesterol stones, pigment stones, and mixed stones. In USA and Europe, 80% are cholesterol or mixed stones, whereas in Asia, 80% are pigment stones. The correct answer in question number 9 is option B. Pigment stones contain less than 30% cholesterol by weight. They usually look black or brown. Black stones are composed of bilirubin mixed with calcium phosphate and calcium bicarbonate. Black stones are associated with hemolytic blood diseases such as hereditary asperocytosis and sickle cell disease. Brown stones contain cholesterol mixed with calcium bilirubinate, calcium palmitate, and calcium stearate. Brown pigment stones are associated with foreign bodies within the bile ducts such as stents or parasites. Pure cholesterol stones account for less than 10% of all stones, and they always contain more than 70% cholesterol by weight. These stones are usually multiple and of variable sizes. They may be hard or soft, faceted or irregular, or mulberry shaped. The correct answer in question number 10 is option C. The cholesterol remains dissolved in bile due to the presence of highly amphiphilic bile salts of cholic acid in the bile. The bile salts of ursodeoxycholic acid and chenodeoxycholic acid solubilize and remove the cholesterol from the stone surface and help in dissolution and passage of stones from the gallbladder and bile ducts.